Assalamu alaikum everyone, welcome to Tawheed Allied Health Sciences. Today we are going to learn how our complete blood count and erythrocyte sedimentation rate are done. First, let us know how complete blood counts are done. By its aim, to detect the complete blood count, and the principle states that the automation of blood count cells was known as Coulter principle. The Coulter principle uses electrical impedance measurements to count blood cells and determine their sizes. It is a technology that remains in use in many automated analyzers. Now let's know the procedure. First, collect the sample from the patient in the EDTA tube. Second, fill the information of the patient on the EDTA tube. Third, manually rotate the sample for 8 to 10 times. Fourth, keep the sample in the rotator for few minutes. Fifth, enter the patient's information in the hematology analyzer machine and place the EDTA tube for aspiration, and within few seconds the results are displayed on the screen. Sixth, take the printout of the result. Let's go through the key indices of CBC along with the normal values for both males and females. Hemoglobin, the oxygen carrying proteins in red blood cells. The normal value for male is 13.5 to 17.5 grams per deciliter, and for female it is 12.0 to 15.5 grams per deciliter. Red blood cell count or RBC, for males it is 4.7 to 6.1 million cells per microliter, and for females 4.2 to 5.4 million cells per microliter. Hematocrit, also known as packed cell volume, normal values for males are 41 to 53% and for females 36 to 46%. White blood cell count or WBCs, it ranges from 4,500 to 11,000 per cell microliter for both males and females. Platelet counts, the normal range is 1,50,000 to 4,50,000 platelets per microliter in both sexes. MCV, mean corpuscular volume, this indicates the size of red blood cells with normal range of 80 to 100 femtoliter. MCH, mean corpuscular hemoglobin, this shows the average amount of hemoglobin per red blood cells ranging from 27 to 32 picograms. MCHC, mean corpuscular hemoglobin concentration, the concentration of hemoglobin in a given volume of red blood cells should be 32 to 36 grams per deciliter. RDW, red cell distribution width, this it indicates variation in red cell size, and the normal range is 11.5 to 14.5%. MPV, mean platelet volume, this reflects the average size of platelets with normal value between 7.5 and 11.5 femtoliter. Now let's look at the differential WBC count. Neutrophils 40 to 70%, lymphocytes 20 to 40%, monocytes 2 to 8%, eosinophil 1 to 6%, basophil 0 to 1%. Lastly, we have the absolute counts. Absolute neutrophil count 2000 to 7000 per microliter. Absolute lymphocyte count 1000 to 4000 cells per microliter. Now let us learn how our erythrocyte sedimentation rate is done. Let's know its aim. It aims to detect the abnormal level of inflammation in the body. Its principle states that it is based on the fact that when a well-mixed venous blood is placed in a vertical tube, the RBCs will settle out of the plasma and fall towards the bottom of the tube, and the pale yellow liquid called plasma rises towards the top.